Maria came to us about 10 days back from Mozambique. Her main problem was that she has a BMI of 42. And what is BMI? It is body mass index, wherein you calculate body mass index by dividing weight in kilograms, dividing it by height in meters square. So she had a BMI of 42, which is considered morbid obesity. And along with obesity, she is suffering from type 2 diabetes for a period of 10 years, which has been uncontrolled for a while. She also had a history of renal artery hypertension with renal artery stenosis, for which she has a stent in situ for that. So with seeing all these diseases behind, we decided to offer a bariatric surgical procedure, and which was laparoscopic sleeve gastrectomy, which was done for her a week back. 3 days after the surgery, she was discharged home in a good condition with she was having a good liquid diet, and now after a week of surgery, she has already progressed to a stage 2 diet, that is a soft diet. Now the advantage of this surgical procedure is that you not only lose weight, but your diabetes comes under control. Primarily secondary to surgery, and number 2, because of the surgery, as the patient loses weight, the diabetes, especially the type 2 diabetes, where patients develop insulin resistance, reduces, and the diabetes comes under control. So far she has done extremely well, and she will be flying back to her country tomorrow. So wherein I'm sure she would also like to speak about her experience at our institute at Max Hospital.
Hi, meet my friend Maria from Mosambique. She's been a follow-up patient of mine for the last 3 years. She's been coming to me for diabetes, hypertension, renal artery stenosis, and obesity. This time when she came to me for an annual checkup, she asked me whether she was fit for a knee surgery. That's when I asked her, why do you want a knee surgery? She says, because I can't walk. I said, with all that amount of weight there, how will you walk? Even if you get a knee replacement, how will you walk? Even the knee replacement would go waste. That's when we discussed the options of weight reduction for her. And since her body mass index was around 40, we suggested that she undergo a bariatric surgery, which is actually the metabolic surgery. And it just took me 5 minutes to explain her what bariatric surgery means and how it affects the sugars and how it helps to improve the quality of life, how it brings down the blood sugar, the blood pressure, and she was ready. Within 5 minutes, she took that decision, and we took her up in 24 hours, discharged her in 3 days' time, and here you are, sitting with the smiling Maria. Maria, how do you feel? Why don't you share your experiences? So what I want to tell people is that bariatric surgery is a surgery for uncontrolled obese diabetics, because it helps you to reverse diabetes. Her insulin requirements are down from 60 units to just 10 units a day. Her blood pressure medications are down from 10 to 2 a day. And this has just been a week that she's had this surgery. Going forward, her insulin requirements and her antihypertensive requirements would probably even fizzle away. So Maria has promised me that she'll be in touch with me. She'll come back to me with her follow-ups, and we've promised her that we'll take her off all diabetic medicines and insulin shots.
My name is Maria Esmeralda. I was sick in 3 years with diabetes and obesity. I knew Dr. Vikash by a friend named Shika in 2010. From this time, I have doing the treatment with Dr. Vikash, and I'm happy. In 2012, I came to meet Dr. Vikash because my diabetes was not going down. So I came here, same in 2013. Now I came for operation in my knee, but the doctor didn't advise me because I have a lot of weight. So as his suggestion, he suggested me to do the stomach intervention operation, as will help me decreasing the weight and diabetes is my problem in knee too. My problem in knee, now I'm perfect okay. I lost 3 kg in 10 days and my diabetes decreased from 16 to 17 to 9 to 10. Okay. I am happy with all operated block and the doctor saw. I recommend to anyone this hospital. When Dr. Vikash suggested me this surgery, I shared with my husband and he immediately accepted. So we shared with the rest of the parents in Mozambique and they agreed too with the same. Now they are only waiting for my regress there in Mozambique and see that I'm really okay. So I'm happy. Me, as Maria's husband, encouraged and helped her in decision to do this surgery. The rest of my family in Mozambique did agree too and search for information about this intervention. What I have doing was give them the reports guaranteeing that everything is okay as true. So I recommend Max Hospital for each and everyone with diabetic problems, stomach surgery necessity, or any kind of necessity intervention. I am diabetic, have 10 years already. I started the treatment in Mozambique, but my diabetics didn't regret. So as invited of a friend, I tried the Indian treatment. So in 2008, I started the treatment and now here I'm happy with my last treatment that I am seeing results inside of 10 days. I advise them to continue treating people in this way. And I recommend any other people to look for Max Hospital. My name is Antonio Mangiati, husband of Maria Esmeralda. I'm her company here, and after everything that I watched and I forward here, in short words, I will say that I'm happy with the treatment that she got from everybody here, special Dr. Manish and Dr. Vikash.